Disclaimer: the following is not meant to replace actual medical advice. Do not risk your health on orgone-related treatment. If you are severely sick, talk to your doctor. Heiko Lassek Orgone Accumulator Therapy. Heiko Lassek began experimenting with the orgone accumulator in 1982. As an established doctor whose practice was framed around the application of the techniques developed by Wilhelm Reich for influencing the vegetative nervous system, he was consulted again and again by people suffering with the Big C in the last stage of the disease. He consulted and cared for 17 so-called terminal Big C patients over 2.5 years. His care included both orgone energetic treatment and psychosomatically orientated vegetotherapy, which was offered free of charge without exception. 2/3 of the patients, after receiving instruction on the use of the orgone accumulator and test sessions, had a clear reduction of the use of analgesics and in some cases freedom from pain. This was achieved on average after 20 exposures to orgone radiation. Lassek was surprised that the patient's vitality was markedly increased, which was to be seen by the resumption of activities completely inconceivable before the beginning of radiation therapy. Medical experience with the therapy developed by Wilhelm Reich, vegeto or orgone therapy. Orgone therapy can be divided into two subgroups which, in the practical work with the diseased person, can intersect or complement one another: psychiatric orgone therapy and biophysical orgone therapy. The way he applied the therapies was subdivided into 3 fields. 1. Long-term therapy. Character analytic vegetotherapy on patients suffering from diseases and somatic symptoms diagnosed by traditional medicine, and these patients have been previously treated with traditional medicine but without good result. In this field, he works with the patient once a week and with anyone outside of Berlin on average every 3 weeks for several hours on successive days. The therapy lasts 1 to 2.5 years on average. Second, intervention therapy. Consultation and demonstration of self-aid techniques harmless to the patient, which can continue independently after instruction is given. Later, if necessary, personal consultation and guidance is given. Thirdly, biophysical intensive therapy. Consultation and guidance of the most seriously ill patients mainly in the last stage of the Big C process. Use of the orgone accumulator and of the diagnostic instrument developed by Wilhelm Reich for the follow-up observation. Experience with long-term therapy. Over the years, Heiko treated many diseases and symptom complexes with vegetotherapy, supported for a short time by use of the orgone accumulator, and had very satisfactory results. Experience with intervention therapy. During his treatments, Lassek treated 41 patients during 2.5 years, with 17 patients having a complete disappearance of the main symptoms. 8 patients had the present condition of pain reduced, and the remaining 16 did not give him significant feedback or had not used the therapy as directed. Experience with the biophysical intensive therapy. From the end of 1987 through 1990, Lassek treated 17 terminally ill patients. From a medical point of view, these patients were completely treated out at the beginning of their orgone therapy. They had been given survival times from 1 to 3 months by their doctor. The course of orgone therapy. During the first 2 to 3 sessions in the orgone accumulator, most of the Big C patients had an uncomfortable somatic sensation. In spite of taking morphine, they often felt a dragging or pulling pain in the location of the metastases. The pain was described in their own words as strange or new compared to their well-known intense pain. In several cases, 1 or 2 more areas of pain were felt and described, each time sharply localized by the patient, which was later proved to be an additional metastases not yet diagnosed at the time of the first session in the accumulator. These patients also reported having a very detailed visual perception of their tumours or metastases while in the accumulator. Heiko found that this first reaction of the organism to the accumulator disappeared after 3 to 6 one-hour sessions and did not reappear unless the daily orgone accumulator therapy was interrupted for several days. After 1 week of treatment, sometimes even during the 2nd or 3rd treatment session, more and more reactions of the entire body were experienced. Sensations such as warmth, heat, dilation of the cutaneous vessels, increase of the peristaltic sounds which were clearly audible without a stethoscope, and a tingling sensation in the limbs but also in the back. The patients said that these side effects were much better than the pain they were experiencing. From there, the intensity of the extreme pain experience decreased. Patients began using the accumulator twice per day, for a 1-hour duration both at noon and in the early evening. After 3 weeks of the large dose accumulator therapy, the extreme pains of 9 of the 17 patients were reduced to such an extent that they no longer desired the daily medication of analgesics. With 5 other patients, before the therapy the pain had been latently present even under strong-term medication, but under the influence of the Orgone therapy, the attacks of pain developed a certain rhythm, where there were periods of complete freedom from pain alternated with periods of the old condition of pain. These patients reduced the long-term medication. Only 3 of the 17 stated that the Orgone accumulator therapy failed to reduce the pain. What was most impressive was the changes in the quality of life of the patients, which was described by their family and friends. After about 3 or 4 weeks of the therapy, the patients began to return to their normal appetite, walks, hobbies, and independent car driving. The general appearance of the patients had also changed, with many reporting a feeling of vitality which they had not felt for many years. Changes in blood diagnosis. Lassek reports that the change in microscopic analysis did not change in the first 3 weeks of treatment. The only noticeable difference was the tendency of red blood cells clumping being at a decrease. During the second month of treatment, the blood picture drastically changed. The membrane cohesion, the internal pressure of the cell membrane and the resistance against the process of disintegration into bions and T bacilli drastically increased. At the beginning of Orgone accumulator therapy, only 10% of the erythrocytes had their original shape. Immediately after withdrawal, it was now more than 50%. The way and speed of the disintegration also changed toward an increase in the power of resistance. Further developments. The subjective freedom from pain and symptoms went along with dramatically changed pictures in the initial blood diagnosis. The change was more notable among those who at first had terrible pain despite the strongest medication and had been prognosticated to survive only 4 to 8 weeks. Surprisingly, the blood picture of 2 people even approached that of a completely healthy person. Some patients even took up sports again, went for long walks and short trips. The final phase of the therapy. After more than 6 months of experiencing physical well-being and freedom from pain, in all but 2 of the 17 patients, Heiko noticed the following process appear. First, the picture of the native blood diagnoses began to deteriorate impressively within a few days. Apart from the erythrocytes showing well-shaped membrane coats and normal disintegration process, single erythrocytes recurred which completely disintegrated into the corpuscles that Reich called T bacilli within 20 minutes. The absolute number of these erythrocytes was small, about 15%. After the living blood picture began to deteriorate, the patients began feeling well. In summary, all 17 of his severely ill patients lived more than 5 months, with 50% living for more than a year. Heiko concluded that the benefits of Orgone therapy to severely ill patients were significant. Thank you for watching. If you found this informative, consider checking out our playlist of suppressed medical technologies. And if you'd like to learn more about the orgonometer, see some of my interviews. Thanks for watching.